Two, three.
My name is Nomafrench Mbombo. I'm the spokesperson for the Western Cape Health MEC, Dr. Nomafrench Mbombo. We are here in the Garden Route today. Firstly, we're starting with a vaccination site visit where she will be talking to the people because we've received complaints that there aren't enough vaccination sites in Mossel Bay. Hence, today we're having this vaccine day here in the Mossel Bay Town Hall. So Minister is here to explain why we're not having as many vaccination sites as people would have expected. Oh, there! Okay, I was wondering, where's the issue? This chew is for the people that will be receiving J&J, and that other chew is for people that will are here for their...
Dr. Botman, so why are you segregating them? There's a J&J, there's a Pfizer.
Yes, they are for the second dose.
Oh, okay. Oh,
And then
second
this
dose.
one. So,
Morning, how are you? Good. You guys, you must only wear the chain. Thank you very much. Looks like you're gonna get the best injection. Yes. Yeah, as you are, this is funny. Okay.
Observation and if they finish, they go and sit there for 15 minutes and then they go out. They know the side effects, they know everything they want to look at, and the panades demonstrate.
So this is a recovery.
This is the recovery, and then they go out.
Okay.
Recovery area.
For the change.
Afterwards. Good morning to the community. I just want to, on behalf of Mossel Bay Council, welcome the Minister, the MEC Mbombo, Nomafrench Mbombo. It's our Minister of Health in the Western Cape. Minister, warm welcome to Mossel Bay. As you know, the Mossel Bay community, a lot of them registered. We're really proud of that. We've got the highest registration rate in the region. So for that, we thank the community. We thank the community for their patience this morning. And we're thankful that we received quite a lot of vaccination shots today. And the plea from Mossel Bay Council, and thank you as well for being here and coming to have a look what's going on here. We've communicated before on various occasions. And I know from the Western Cape government side, you're also fighting to up the number of shots that we can provide per day. So thank you very much for that.
Just again, a warm welcome to the Minister and the team. And I really hope they accomplish what they came for. And I just want to say again, thanks to our new hospital board, all the members that are here, quite a few of them, too many to introduce now. It's our first meeting, and we will start knowing each other much better in the future. And I'm quite positive. I know it's something that lies very near to the heart of the Minister, the hospital boards, and I'm sure together we can make a difference in the community and fulfill the purpose of the hospital board. And I can perhaps just give a little bit of respect to the five team leaders. There's Sister Lambrecht that's running the town hall usually. Then Sister Meider is doing the Almeida Civic Center. Sister Bush is doing our roving team, the mobile team. And they're going to the far off places and we're trying to support the poorer communities there. Then Sister Jackie Matimba at Wolverdam's Voortbrug Civic Center or Community Hall, and then at Alma Clinic, Sister Marie. So just again from my side, I'm very grateful to them, and I see these people coming in after doing vaccinations for the day, coming in sometimes past 8 o'clock in the evenings. There's Saturday and Sunday busy with COVID related admin stuff, and you can always press on their number and ask them if there's any favors to do. They really bring their part, and I'm very proud of them and very grateful to be a part of such a team. And then just in short, at the moment, continuously we're thinking that we're past the peak of the third wave, but the numbers are now and then. We saw yesterday, for example, the 24 new cases. That was half of them from private and half of them from public. So that's quite low numbers, but recently up till last week we still had cases more than 100 a day. So hopefully we passed the peak after third wave, but just as we get hope, it comes up again. At the moment currently we've got just above 700 active cases.
Okay, Dr. Mossel, you want to say? We received for J&J, we received 1,112 last week, and we had a little bit left over from the previous week that we add to stretch a little further, because we reach out to the farm areas specifically, and then for this grand visit from MEC here to us to get the people here and to listen to a voice. And then for Pfizer, last week we managed to have second doses for all. We received 1,206 doses of the Pfizers, and that really just cover our second dose patients who were on the appointment system for this week.
Thank you. Good morning, Mossel Bay. My name is Nomafrench Mbombo, the MEC for Health in the Western Cape. Just to check, the checklist is that we are making sure that we are outside, so that when we keep on saying that avoid crowded places, avoid poor ventilation, keep the distance. Keep the distance. At least we're outside. And also sanitize. I've got my sanitizer, so that's why I keep on sanitizing them. Although is a doctor, probably I might forget because was busy speaking. So it's crucial. So we expect the same also to the community. Just a reminder: you are vaccinated. It means that at least there is a guarantee that we will be able to reduce the level of infection in our community. However, we do know, when you're vaccinated, it doesn't mean you cannot contract COVID. NB, you cannot contract COVID because it's not 100% effective in terms of getting infection. But the guarantee, the main reason for vaccination, it's about it can prevent the moderately to severe illnesses, plus also prevent the deaths, especially with the older persons and all of those comorbidities. That's why we talk about the priorities. If there are shortage of vaccines, let's give it to the omas and the opas. Because with the young ones, yes, you're also gonna die if you have to die, but at least the level, the severity is not as higher compared to the older persons. Also, number 3, we do know there's an evidence that even if you are vaccinated, you're still gonna carry the virus in your nose, in your throats, when you're infected. Therefore, you still have to wear your mask, especially when you're indoors. Remember, in the USA now, they've introduced that you have to wear the mask indoors. Although initially it was about everyone wearing mask. So you're still going to spread the infection, even if you are vaccinated. That is important. And then thirdly, just any foreign body, just like whether Panadol, a medicine, there will always be expected side effects. Just like when you take one pill of Panadol, where for me it can just knock me off and then sleep. Whilst that when it's taken by Mr. Kota, there's nothing. Similar with the vaccines. Some of you, which is expected, you'll have some rashes on the area where it can be itchy. You might have some 2 to 4 days, some being fluish, muscle ache and all of those. It's your immune response, it's your body, which is now receiving a foreign object, and now it's reacting to it. So a body immunity response to this foreign object, which is the vaccine, it is expected. However, there are adverse effects that are being known. That's why when you get inside there, they will ask you about this information, and they say, do you agree? You recall the time that when we were introducing J&J to the healthcare workers, and then it was paused because they said that in the US, the FDA found out that there were some cases of the people who developed clotting. I think it was 7 million, 6 people out of the 7 million. And then South Africa has to pause it to check whether are there any of those adverse effects from those healthcare workers who were vaccinated. And then it was paused, and then they came back that they didn't have, but also since some of them might have these pre-existing cardio or clotting kind of effects pre-COVID, probably they may end up developing those, or others may develop. Therefore, there must be some warning that is there. But the country has got what we call compensation fund, just in case you have got adverse events that were not necessarily part of those, or some of them might be reacting to the ingredients of the vaccine, not necessarily to the whole package of the vaccine. But there is that process. There is a number where you get an SMS where you can call just in case. So the vaccines are guaranteed safe. The vaccines are guaranteed safe. Rather to have a vaccine than to go to a ventilator where you'll be competing with the rest when you don't vaccinate. So thank you very much. We want to open up. We're tired of COVID. Everyone has got COVID pandemic. Everyone has got COVID fatigue. Everyone is pandemic fatigue, is a mask fatigue, we understand. But in order for us going to the fourth wave, like you might have a fourth wave, that could be at least not be so severe. Just like now we see the third wave is as equal to the second wave, because still we haven't vaccinated as many people. We want to ensure, come the fourth wave, whether it could be October, November, December, I don't know, at least 67% of the people in the country are vaccinated, including in the Western Cape. We want to open up. Thank you very much. Thank you.
Thank you very much, Minister Dr. Nomafrench Mbombo. Very well explained. Thanks a lot. From council side, thank you once again for visiting us. Thank you for the Western Cape government listening to the plea of our community. Then for the community here this morning, thank you for coming to vaccinate. We really appreciate it. And we will have a drive as soon as we receive even more vaccines. We will drive it harder from the municipality side and from our partner side, the media. Mossel Bay Advertiser is also here this morning. We work well together most of the times, actually all the time. Then to Dr. Botman, his whole team, to you and all your staff from our side also, various communications went to you with immediate help. We appreciate that, but not only that, we appreciate the service that you are delivering to our communities. We know that you are working long hours, after hours. So everybody involved in the health sector in Mossel Bay, from council side, we really salute you and thank you very much for your hard work. And then to our municipal manager, Mr. Colin Perrin, to him and his whole team, staff, thank you also for availing the services from the municipality side. So thank you once again. And then obviously to the partners. Mossel Bay municipality does not operate as an island. We've got various partners and we've seen this commitment here this morning. Actually all the people standing here in the middle, Minister, is partners. They don't have to be here. They've got actually nothing to do with this function except for coming to listen to you and to see how the Minister looks. But this is the kind of commitment that we've got in Mossel Bay. So to our partners, we thank you very much for that.